There's a $5 bag of potting mix sitting in millions of garages and garden sheds right now, and inside it is a microscopic parasite that, in severe untreated cases, can scar your cornea badly enough to threaten your vision. Most people have never heard of it, and the ones who have usually only found out after it was already a serious problem. This video is about Acanthamoeba, a parasite that lives in ordinary bagged potting soil, and what happens when it gets into your eyes. Now, I know what you're thinking. I've been gardening for years, and I'm fine. And for the vast majority of people, that's true. This is a rare condition, but it's also exactly why this is worth a few minutes of your attention. This thing doesn't announce itself. It mimics other infections convincingly enough that even doctors miss it for weeks. By the time anyone figures out what's actually going on, real damage can already be done. I've gone through the research, peer-reviewed studies, documented case reports, and clinical guidelines, and there are things in here that even experienced gardeners have never been told. So let's get into it. The second most important thing you need to understand about Acanthamoeba is where it actually lives, because most people picture some exotic tropical parasite, and that couldn't be further from the truth. This organism is genuinely everywhere. It's been found in freshwater, in soil, in the air inside your home, and in the nose and throat of completely healthy people with zero symptoms. Think about that for a second. Some people are carrying trace amounts of this parasite in their respiratory tract right now and have no idea because their immune system is keeping it in check without any issue. The problem only starts when it gets somewhere it can actually do damage, like the surface of your eye. And the reason potting mix is a specific point of concern is that it's a concentrated, moist, enclosed environment where Acanthamoeba can persist. Open the bag, lean over it, and you can release fine particles toward your face without ever noticing. But here's where it gets more unsettling, because Acanthamoeba has a trick that makes it notoriously hard to kill with normal household disinfectants. It exists in two completely different forms. The first is the active feeding form, the trophozoite, the living, moving version of the organism. The second is the cyst form. When conditions get harsh, too dry, too cold, not enough nutrients, the organism folds itself into a hardened shell and waits. It can survive in that cyst state for a long time. Standard disinfectants don't reliably break through it, and even some prescription treatments struggle with it. So the assumption that you could just rinse your eye out and be fine isn't how this organism actually behaves. Once an infection is established, it's genuinely difficult to clear. And the reason the eye is a uniquely vulnerable entry point comes down to temperature. Acanthamoeba multiplies fastest at temperatures between roughly 28 and 37 degrees Celsius. The surface of the human eye sits right inside that range. So the eye isn't just a place this organism can survive, it's close to an ideal growth environment if it gets the chance to establish itself there. Quick question. If someone told you there was a parasite in your garden with a temperature sweet spot that happens to match your eye almost exactly, would you keep gardening without any eye protection? Most people would say no, but almost no one actually wears protective eyewear while handling potting mix. The official clinical guidance actually does say that people who work regularly with soil or contaminated water should wear protective eyewear. It's a real recommendation. It's just one that almost nobody passes on to casual home gardeners. Now, the most important thing in this entire video, the part that I think genuinely changes how you see this risk, is what happens after someone gets infected and why it so often goes undetected until meaningful damage has occurred. Acanthamoeba keratitis, the name for this eye infection, is notorious for being misdiagnosed. Not just once, patients are often treated for the wrong infection entirely for weeks before anyone identifies the real cause. The reason is that it looks almost identical to other, far more common eye infections. Redness, pain, light sensitivity, blurred vision. These are the same symptoms you'd get from an ordinary bacterial infection. So when a patient walks into a clinic, the first assumption is almost never Acanthamoeba because statistically it shouldn't be. They get treated for the more likely thing first. If that treatment doesn't work and nobody escalates the testing, the infection keeps progressing in the meantime. There is one clinical sign doctors specifically look for, a pattern of nerve inflammation that spreads across the cornea in lines radiating outward, like spokes on a wheel. It's called radial keratitis, and it's one of the more distinctive findings. But here's the catch. Studies show it appears in about 57% of eyes diagnosed within the first month of infection. After 2 months, that number drops to 29%. So the longer the infection goes undiagnosed, the harder it becomes to identify even using the specific marker that's supposed to help. The window for catching it clearly is narrow, and most people aren't in a doctor's office during that window because they assume they just have irritated eyes. That's important, but if you don't understand who's actually most at risk here, you might wrongly assume this doesn't apply to you. Contact lens wearers are the highest risk group by a significant margin, and the specific behaviors that increase risk aren't exotic. They're things millions of people do every day without thinking twice. Showering with contact lenses in, swimming with them in, rinsing lenses with tap water instead of proper solution, using homemade cleaning solutions. Each of those moments creates an opportunity for Acanthamoeba sitting in ordinary water to get trapped between the lens and the surface of the eye, a warm, moist, enclosed space where it can establish itself. The lens essentially acts like a delivery mechanism, holding the organism in direct contact with the cornea for hours at a time. And here's something that surprised me in the research. Even daily disposable lenses, often marketed as the safer option, haven't actually been proven to lower the risk of Acanthamoeba keratitis. The assumption is that throwing the lens away each day means less buildup and less contamination. The evidence doesn't clearly confirm that yet. The risk seems to track more with behavior than with lens type. Put in a fresh daily lens and jump straight into the shower, and you're still exposed. By the way, I keep a guide like this for every video inside a small community I run, where you can also ask me questions directly. Links in the description. Now, let's talk about what happens in cases where this goes untreated or where treatment is delayed too long, because in a small number of cases, the outcomes do get genuinely severe. In advanced cases, the infection doesn't just scar the cornea, it can cause open ulcers on the surface of the eye. The cornea, the clear front layer that focuses light into your eye, can start to break down structurally. In the most severe cases, the only way to meaningfully restore vision is a full corneal transplant. That's not a minor procedure, and even after a transplant, there's no absolute guarantee the infection won't recur. It's important to be clear that this is the rare, worst-case outcome, not the typical one, but it's a real one, and it's the reason early, correct diagnosis matters so much. And then there's a case that puts the bigger picture into perspective. There's a documented case in the New England Journal of Medicine of an 82-year-old man who developed a brain infection, specifically granulomatous amoebic encephalitis. What happens when Acanthamoeba reaches the central nervous system? After doing nothing more than potting plants, not eating contaminated food, not touching a wound, just normal gardening. He was hospitalized and died within a week. Researchers believe the likely route of exposure was simple contact with soil during routine plant maintenance. Cases like this are extremely rare and tend to involve people with weakened immune systems, but it's a reminder that for that specific group, the stakes with this organism go beyond vision. So let's bring this together. Acanthamoeba isn't a rare exotic pathogen you'd have to go looking for. It's in the potting mix in your shed right now, in tap water, in the air. Wear eye protection when handling potting mix or working with soil. If you wear contact lenses, take them out before you shower, before you swim, and before any gardening. Use proper lens solution, never tap water or homemade mixes. And if an eye infection isn't improving on standard treatment, or if pain and light sensitivity follow gardening or water exposure while wearing lenses, don't just wait it out. See an eye doctor and specifically mention the exposure, because that context changes what they test for. The reason almost nobody has heard any of this is simple. It's not on the bag of potting mix. There's no warning label. It just sits quietly in the environment, waiting for the right conditions, and the surface of your eye happens to be exactly that. Some garden threats you can see. This one, you can't. Watch that one next.